Wow, speaking of great patriots and people who've served their country, why, if only someone like that would call now. What? Why? Who is it, Jim?
From the great Commonwealth of Pennsylvania, it's Representative Joe Sestak.
Are you sure you didn't mean senator?
Soon to be senator, we hope.
Oh, you read it wrong, perhaps. Good morning, Congressman.
Good morning, Stephanie. Thanks for having me again.
Thanks for coming on. I always make that mistake. I'm sorry. I don't know how that keeps popping into my head. Senator Joe Sestak.
Well, hopefully soon.
Me too. So, Congressman, you were the first one elected, I understand, to hold a town hall to address health care after the recess. You had like 1,000 people there. I hear you stayed 5 hours to answer questions.
I did. Well, actually, the very first one had 400 people. It was 10 a.m. on a Saturday morning after we got out on a Friday afternoon. And then I held another one, and you're right. It was 1,000 people, and we stayed until the last group left. And
wow.
Why not? This is so important. I'm actually on 7 TV or radio shows today. I just left the meeting at a pediatric hospital where we had a large group and the TV came to talk about this bill and other issues.
Congressman, you know I love you, but here's a little tip for you. Don't tell a woman that you're going to cheat on her with other radio hosts in the same day.
Oh, stop it.
Oh, my gosh, I'm sorry.
No, he's getting his point out there, and that's great.
Yeah. No, that's absolutely, no, I mean, that's exactly what we need to do is, Congressman, I think that we haven't done necessarily the best job on our side explaining things. I mean, granted, we are dealing with, as I always say, a wall of lies on the other side. But I think that it really behooves us to do what you're doing, is answer every question.
Stephanie, if I could, thank you for saying that. When I went to the 67 counties throughout Pennsylvania in July, and I was meeting primarily with Democrats because I was introducing myself before I got in the race against Arlen Specter, they had questions. Our meetings would always be 95% on health care. And although they weren't loud and boisterous, they wanted to know because government had let them down over the last 8 years of the Bush administration, and they want to make sure that we're going to get this right.
Well, and you obviously, as the highest-ranking veteran ever elected to Congress, you were talking to veterans, and you've had to be, somebody that's also knocking down one of these lies, and that is that, veterans' benefits are going to be affected. You absolutely, the other day, we were quoted as saying nothing will change. See Section 202. It states explicitly that VA benefits and TRICARE will not change, right?
You are absolutely right. It says it. It says TRICARE for the active and TRICARE for the retired military doesn't change. And as far as Veterans Administration benefits, they say exactly the same. And in addition, President Obama, in this bill, is going to bring back in all the Priority 8 veterans, about 1 million of them, that President Bush pushed out of the VA system because they happened to earn just over $29,000 in 2003. He's even going to bring more people into the VA system who have served our country.
Well, I mean, you've spoken to these issues for a while about, post-traumatic stress disorder, that we're not dealing with it adequately. You had a great quote. You said it's just like George Washington said, how well you take care of your veterans will determine how well we'll be able to recruit in the future, which is, another very practical aspect of all of this, beside it being just the right thing to do.
Correct. We have 32% of our National Guard's men and women coming home with post-traumatic stress disorder. Now, mind you, and I know I'm not on this, but the chairman of the Veterans Affairs Committee in 2003 and 4, which was Arlen Specter, they actually voted in those following years against $2.5 billion for post-traumatic stress disorder. What? We have actually placed in the last 2 years close to $10 billion in appropriated money for the signature issue of this war. And if we don't address that issue, we are going to see an increase as of how many homeless are veterans. Right now, Stephanie, as you probably know, 1 out of every 4 homeless is a veteran, and the Iraqi and Afghanistan vets are showing up more quickly than the Korean or Vietnam vets on our homeless roll as they come home in a very savage recession.
Yep. Well, Congressman, I think that part of this, too, is that, you, like the president, like, any of us on the Democratic side have had to just sort of combat one lie after another. I mean, you've had to, shoot down the veterans benefit lie on health care from the Republican side. The president yesterday had to say no, there is nothing in the bills that gives your health insurance to illegal immigrants. No, there is nothing in the bill that, that creates a death panel. Are we going to win this debate in the long term? What do you think is going to happen here?
We are and we must win this debate because every day 14,000 Americans lose their health care plan. That's like the city of Bethlehem one week. Everybody in Pennsylvania losing their health care plan. And the other thing that has to happen, Stephanie, is the public health care plan option. In Pennsylvania, 2 companies have over 60% of all private health care plans throughout the state. That's almost like a cartel. And while I want to get everybody covered by the mandate of the universal coverage in our House reform bill, if we want real reform, we need to get competition. And this public health care plan, which is subsidized by the co-pays and premiums of those that choose to join it, not by the government, but it doesn't pay $20 million to a CEO for their salary, or as just happened, $70 million severance pay, gets us to lowering the premiums because of the competition.
Right.
That's reform.
Congressman, the thing I was most heartened by yesterday is it seems like Speaker Pelosi has finally drawn a line in the sand. She said, period, there is no way, I can pass a bill in the House without a public option.
That's right. I think you're seeing that a lot more attention is coming to it. And I also believe this. Better explanations are coming to why the public health care option is good for the pocketbook of Americans and our economy. It's lowering the rise of the curve of the health care cost curve. This is so important. I'm hoping that the majority leader, Senator Reid of the Senate, will do what Ms. Pelosi just did. Speak strongly of the need economically for our pocketbook of the public health care plan option.
Congressman Sestak, let's talk about Afghanistan quickly before you go, because obviously they just had the elections. What is your take on what's our situation in Afghanistan? Because I know many people, myself included, sometimes I'm not clear what the goal still is in Afghanistan. I understand we got distracted by going into Iraq. We didn't get the guys that were actually behind 9/11, but what is the plan now, and how long is it going to go on?
The goal is the eradication of al-Qaeda in Pakistan. And then, and this is important, I think, to keep in mind, it's about 30% of the Taliban that are really al-Qaeda-ized and very radical. About 70% of the Taliban in Afghanistan, and we need to have an exit strategy of benchmarks, success, and failures, but about 70% of the Taliban there are really there, according to several studies, because it gives them a living wage. We've had hundreds of thousands of Muslim men in Tajikistan who used to work in the oil fields of Russia. They've come home without a job in this recession. They're being attracted to a job. And so when people talk about Vietnam, we need to keep in mind that at most the Taliban number is about 20,000, of which 70% are there for almost a job. We can deal with that.
You've probably seen the latest. You've probably seen the latest polling, Congressman. The American people really largely have turned against this Afghanistan war. I think that, again, I think it's tough to understand what the mission is and how long it's going to go on. I think that, I think the Bush administration so bungled, Afghanistan by going into Iraq that I think now, because when you even say that, well, they're in Pakistan, then my question is, then why are we in Afghanistan?
You've got it. And here's the issue. We're really, in my opinion, in Afghanistan as a base to finish the job of the al-Qaeda, who can't be permitted to have a safe haven to plan against us another 9/11. But leaving Afghanistan, the president has to provide, and I voted with the Democrats, and about 60 of them, it didn't get passed, of what's called, as you know, an exit strategy that says this is the benchmark for success and failure along the way. And here's what we're trying to do in Afghanistan. Afghanistan doesn't mean turn it into a nation-building project. It means just making sure that the worst Taliban, about 30% of the 20,000 are taken care of, but we remove ourselves as we finish with al-Qaeda in Pakistan. It's really a base. We don't have to leave behind a nation totally rebuilt. We need to leave behind a modicum of stability so al-Qaeda cannot necessarily come back with ease. Okay. That's the objective, and we don't put out the benchmarks of how we're doing that, not really with our military in Afghanistan. It's having enough jobs other issues available, not big paying jobs, but the microloans, et cetera, of which we've now appropriated $175 million to enhance a wonderful program there. And Stephanie, you're right. We aren't clearly laying it out well.
Yep. Well, that's what you're so good at. And Congressman, we always appreciate you taking time for us. And this was somewhat less than the 5 hours you answered questions at the town hall. Although many men tell me it seems like 5 hours talking to me for 5 minutes. Thank you so much for taking time for us as always. Congressman Joe Sestak of the great Commonwealth of Pennsylvania. Thank you, Congressman. All right. There he goes. It's
What?
5 hours he answered questions.
Good on him.
Wow.